All right, welcome back from lunch. It's so one of the things I like, there's a lot of things I like about today, but one of the things is we are so used to not seeing each other and being on Zoom that actually there's a lot of energy of people talking to each other. And that's great, but we do have to continue on with our meeting. But I appreciate the fact that there's a lot of enthusiasm of seeing each other in three dimensions. I've seen plastic surgeons talking to pediatric surgeons and vascular surgeons talking to transplant surgeons and folks from the VA talking to someone from Seattle Children's. Those are all kind of silos that we live in, and this is a chance that we get to see the people that we count as friends and colleagues, but don't get to see every day. And so, you know, we come to the even a better part of what's already a great day. I think that it's uncommon that we have these opportunities to come together, and this is a chance to celebrate the power of scientific inquiry and the people that move it forward. And this scientific inquiry is the progress that moves us forward, that takes what we're doing today and makes it better tomorrow. And twice a year, we get to meet together in a room like this and have a chance to see what's going on and see what our people are doing. And our dedication to patients, to our colleagues, and our commitment to a culture of inquiry is really what makes this a great department and a department full of great people. And so as part of that, we are really privileged to have Dr. Selwyn Vickers here as really a model of science, leadership, and purpose, and how it can come together to improve human health on a profound scale. And Dr. Vickers has had his footprint and fingerprints on many of our major institutions and has had outsized influence in healthcare. He trained at Hopkins for all of his undergraduate, graduate, and then postgraduate education, and then rose through the ranks at University of Alabama, Birmingham, rising to full professor, and was recruited to be the chair of surgery at the University of Minnesota, where he stayed for several years before Alabama recruited him back to be the dean, where he rose to be dean and ultimately CEO of UAB. And then, as we all know, he was recruited to Memorial Sloan Kettering, where he is the president and CEO of our amazing cancer center, Memorial Sloan Kettering. And as president and CEO, he's had incredible influence, not just as a world-renowned pancreatic surgeon, but a pioneering cancer biologist. He's one of the world's foremost voices in addressing cancer disparities. Dr. Vickers' research spans over 25 years of funded NIH funding, with over 270 peer-reviewed publications and major contributions in understanding molecular basis of pancreatic adenocarcinoma, innovative therapeutics, and inequities in cancer care. Dr. Vickers is one of those rare individuals who is a member of the National Academy of Medicine, a fellow of the American Association for Cancer Research, and an honorary member of the American Society of Clinical Investigation, and a member of 22 other professional organizations, many of which he's had major leadership positions in. Dr. Vickers' influence has shaped not only the scientific landscape, but also the institutions responsible for delivering care, training future physicians, and addressing deep-rooted disparities in access and outcomes. Dr. Vickers embodies what it means to be a surgeon, a scientist, and leader in the truest sense. As you've seen from his questions today and the questions yesterday in our roundtable, he's curious, he's rigorous, he's unafraid to ask difficult questions and to challenge dogma. He's committed to using evidence to make the world better. And he's been committed to advancing discovery and ensuring that progress in cancer treatment lifts every community. So, Dr. Vickers, we are very proud to have you here visiting us and welcome you to be our Schilling Professor and Lecturer this year. Thank you.
Thank you, Doug. It's really a pleasure. It's been a little time coming for me to be able to make this trip, but I'm excited to be here and I've enjoyed every moment of it. I've enjoyed hearing a lot of both cancer talks and non-cancer talks as well. So it's really been remarkable. So one of the things I've learned really is that the way I would describe both my experience and what I've observed about your department and your institution is that this is an American treasure. The level of talent, the level of consistent leadership is rare. And it's also in the context of a university that has a state name, but has a national and international influence. And there's probably no better beacon of that than the Department of Surgery. So for you who don't know it, don't take this place for granted. It is tremendously depth of talent, the investigation, the commitment to research, the commitment to great clinical care. You're very fortunate and you've had a consistent run of great leadership that really makes a big part of it. So it's an honor for me to be here. I think this is a jewel for America, clearly the crown jewel in the northwest part of our country. Just only imagine what this area would look like if this department and this university wasn't here. Just think about that. And also think about the landscape of the impact that you've had, not only here, but in the nation. So thank you for what you all have done. And it's an honor to be a part of the tradition of your former chair and being a Schilling visiting professor. He obviously another member who laid the foundation, but I wouldn't be able to start my talk without highlighting these three individuals. Doug, thank you for having me. You've asked me a little while back, and things are calmer, and I was excited to get on a plane to get out of New York. And it's been a worthwhile trip. Carlos has been a friend for a long time and has been a great advisor. I've been an admirer of his and had been appreciative of what his passion is, as he's an honorary fellow of SBAS and one who I really care dearly. And Ron and I have gotten to know each other well. First in Argentina, where we were actually giving talks in a similar time period and ate more beef than we could ever have, and drank some very good wine that wasn't costly. But he's a phenomenal leader as I've gotten to know him through the American Surgical. So it's just rare that I could show this slide about any institution where these three individuals are recognized internationally for their skill, their surgical leadership, but admired in their communities for being outstanding leaders. And so I'm proud to be here and want to let you know how fortunate you are to have it. So I'm going to speak a little bit about Memorial. What I would say that is critical for us are these core values that we live through. And just since we've been here, we've really established what our mission is. And that is ending cancer for life and to be a leading authority on cancer care. Memorial is the oldest private cancer hospital and is used to have the luxury of being the choice for cancer in town. But within 20 blocks, there are 4 other NCI designated cancer centers. And so the competition is immense. I told someone this morning the most valuable currency in the healthcare economy in New York is a cancer patient. So that when a cancer patient is identified on Epic coming to Memorial, they get a call that same day from the health system they came from, letting them know that they can be seen a day earlier and they don't have to go to Memorial. So it's a very competitive world in that space. There are days I wish we had cardiac surgery. But in reality, this is a busy place, a good opportunity to grow. And we're having to build, I was just telling Doug, a new hospital, and it stretches us every day. It's a $2.4 billion facility. It'll be the tallest clinical care facility for cancer probably in the country. But absolutely necessary, just because our place runs at 114% occupancy, probably like yours, and we need the space. So we're well on our way to get that done, and hopefully we'll improve the world we live in. So I'm going to talk about a couple things. I'll speak about my own personal academic journey, and then I'll speak the second half about some traits of leadership development and a final set of thoughts on leadership that have governed a large part of my thinking. You have some phenomenal leaders here. It's going to be like taking coals to Newcastle, but it's personal for some of these things for me, and you have a great environment to continually learn as well as apply many of the things I might say. Practically, typically you sort of acknowledge your partners at the end of the talk. I'm going to start with mine, this simple principle. So my traveling companions are these individuals. My wife, I have 4 kids, and I have a son-in-law now. And so they're the people who've been on my journey with me. They're great, but they cost a lot of money. Particularly that wedding. We're still thinking about that. But what I've learned the most, this is a book I'll share that I didn't learn till late. It just speaks to the tunes of how your loved ones respond to things they like. I typically, for the first 20 years of my marriage, I gave my wife what I liked. And I gave my kids what I liked. And it became very clear. My son, my first 2 kids grew up in the hood in Baltimore. They never got mono. My other 2 kids grew up in the suburbs. They got very bad mono in Minnesota. But my son had really bad mesenteric lymphomatosis, blocked duodenum. And he was in the hospital for 2 weeks. And our head of pediatric surgery said to him, "You're going home now, Ben, but something had to be decent about the stay in the hospital besides the video room." And he came, pediatric head of surgery came and told me this. But he said, "The thing that I really enjoyed the most was for 2 weeks, every night my dad came in and spent the night." And I learned that for my son, what really matters to him really is quality time. Same for my wife. She doesn't care so much for gifts. She wants time. I have a daughter, you can give her all the time in the world, but if you bring a gift, you're showing love to her. I have another daughter who really needs words of affirmation, right? And she loves to hear things that speak positively about it. And I have another daughter who just, when I see her, you got to give me a hug, right? Touch is important. That identification of what conveys love to them, not just to me, is really a helpful piece to understand how in the outside world, with what little time you have, you appropriately convey that to the people you care about. So a good book, I enjoy it, and those 5 things have helped me understand my family and learn how to relate to them with the time I have. So my journey is from an area in Alabama called the Black Belt. If you take the Black Belt out of Alabama, it's in the top 5 of every socioeconomic category in the country. So that tells you how challenged the Black Belt is. But I grew up there, born there, and then a journey where learned a lot of lessons. A grandmother who had to travel 150 miles to get a high school degree, 10 summers to graduate from college in the 1930s. A grandfather who signed his name with an X until he was 44 years old and could go back to school and learn how to sign his name and became the mayor of his town. So certainly a place where I've lived and what I've gained, as you see on a regular basis, education is the great equalizer. And that's the journey that began leaving Alabama, coming to Baltimore, staying in Baltimore for a significant period of time, and ending up at Memorial. 2 really existential moves. Leaving Baltimore to go back to Alabama was a big existential move. Baltimore at that time was my home, and leaving Birmingham, going to New York, an existential move, because at that time, Birmingham was my home. So those were both challenging. The med school to residency, there were mentors along the way. And Levi Watkins was a phenomenal leader. And then Levi drove Martin Luther King as a high school student in Montgomery, Alabama. Levi was the first African-American to graduate from cardiac surgery at Johns Hopkins and stayed on as professor. He was a person, if you had a fight, Levi was the dog who wanted in that fight. Hopkins, and Doug will know this, Hopkins at the time, if you were a bright kid, you considered Hopkins or Harvard, and if you were a black bright kid, you never thought about Harvard. The minority sort of percentage when we started was about 3% of Johns Hopkins. By the time Levi became a full professor, it was close to 15. And he wrote every African-American student in the country going to med school and asked him to apply for them. And then he fought for them today. And then he showed the institution because routinely the number one or the top 10% of the class were the African-American students. So he was transformative in doing that. During your research years, and my research years was a guy named Greg Bulkley. Greg was a consummate researcher, loved research, was funded for his entire academic career, gave me the passion about research. He ran his lab like he ran a clinical business, and really gave me insight what passion and purpose of research was. My focus back then was proving, so I developed first monoclonal antibody for xanthine. It was the height of free radical biology, where reperfusion was the cause of every disease we knew, at least in our mind. A part of my journey was proving that xanthine was on the endothelial side of the endothelial cell versus the adventitious side, and a monoclonal antibody, which was just being developed, that I helped develop, was the tool to actually prove that. And the unique thing about the research is, obviously the journey to become a consummate surgeon is over multiple times, but you can become a world expert in your area, in your research. You can know as much as anybody in the literature. My first talk, I convinced my wife this was a good thing, that I took a talk with Greg in Belgium. And so we flew to Belgium. She was like, okay, why are we going over here? So I gave my talk, and then they gave me $1,500 in cash. She said, I like this. And for a resident to have that level of money in your pocket after a talk, it really got the bug of academic surgery and saying, man, this is what I want to do. So as you all know, this journey of supervised growth, it occurs throughout the last years. Doug and I were talking about those days where in our final years, we were these junior faculty or instructors, which had massive autonomy. You did a tremendous amount of complex cases with modest oversight, but your maturation grew, and we learned a lot from that time period. So this is that fellowship. So you had watchful autonomy, you did anything from vascular, you also still operated with the professor, but you also trained the chief resident under you. You got a chance to manage teams. You got a chance to actually be an instructor and teaching teams. So it was really powerful, not only in your skills, but also in your surgical leadership opportunities. So as you look at a career, I think many times we think it's just this ladder. And yet, in fact, it can be more like the right side of the picture. It can be a bit circuitous. And many of you will know that your journey has not been just a straight line. And so, one, I want to get rid of the idea that it's just going to be a straight line, but many times it's many different steps to get to where you want to go. So when you're looking for your first academic job, like many of you do now, networking is really important, but really listening to your leaders, your chairman, your division directors, your research directors and vice chairs, those are all very vital. And that was my journey. I had mentors at Stanford, the Mayo Clinic, at UAB. I had a colleague in Vanderbilt. But Dr. Cameron made it clear there was only one place where I was to stay and should stay, and that was at Hopkins. He'd spent the year preaching that to me. I took a job for 2 weeks to stay on faculty and then changed my mind. After I told him, he kicked me out of his office, and he didn't talk to me for 2 years. And it was a painful last 6 months of my training, because knowing what he thought and what he meant to me, he was certainly like a professional father in so many ways. But I went to UAB largely because my wife and I are from Alabama, and we wanted to go back, and I felt it could give me a chance to still grow my career. So what I identified was the fact that I had to first see where there are good people. Now, there are three things that are really important in a job: good people, good place, good program. The only one that matters is good people. If you have good people, you can make it. You can have a great program and be in a great place, but if the people are not good, you won't be there long. And so the other factors that I had was to make sure I had an engaged mentor. I had sponsors and coaches, as you'll see me talk about. And I felt I had the runway to do whatever I could do at Hopkins, I could do there. And so I built a network before I left. I came with funding because I had an institutional fund, but I also got society funding. And I made it clear. Now, although my basic research with Greg was on free radical biology, after that year with John, it was very clear to me that the problem to help solve was pancreatic cancer. So I changed my entire focus on free radical biology. And I had it more as a peripheral part, because UAB had an outstanding free radical biology group, but I had a focus on pancreatic cancer. So in my first job, this guy, Tony Thompson, was a growth factor biologist. And one of my faculty members at Memorial said, I just saw one of your papers on FGF growth factor type 2 and type 1 in pancreatic cancer. And that's what my early work was on, was looking at growth factors that nobody had defined in pancreatic cancer as part of the oncogenesis of adenocarcinoma. Practically, what I would say to you that made a difference is that I had an embedded lab. So I had funding, and I really wanted to make sure I kept the process of, first of all, doing my first job well. My first job well was to be a really good clinician. I was a new kid from a different place. No one knew me there. I was the first Black surgeon that Gil Didion had hired in the institution's history. And so that context meant that I didn't have a lot of room for error, right? So my first case I took care of was a man who had a stricture in his left hepatic duct and had been told for 6 months it was benign. I told him that I think you have a cholangiocarcinoma, and I realized you've been told that. One of the other gastroenterologists took me by the chin because he thought it was the same. They called back to Hopkins to see if I really trained. And I can get that there is no place in their world where a Black man is coming to tell them they're going to take half their liver out. Right? That was just as foreign, and I would be scared too. But after they called, and the program director said, yes, he's in Alabama, but we wanted to keep him, but he chose to go. They became comfortable, and when I did their hepatic resection, their left lobectomy was cholangiocarcinoma, he became my best until the tumor came back and unfortunately passed. But that's to say that my focus was, first of all, being an outstanding clinical doctor. That was the foundation for me having a research career. If I didn't do that job well, everything else will probably not accept it, or be, in some ways, have limited validity for what I wanted to do. So if I was going to actually do research on pancreatic cancer, I actually needed to do that well. And fortunately, my clinical boss allowed me to grow. My first cases, my first 20 whippers were all on chronic pancreatitis. Nobody wanted to give me the cancer, but I learned a lot in those difficult pancreatitis cases and eventually started growing. So got awards from foundations and societies, grew a platform of not only both building a practice, building a pancreatobiliary center, and eventually gaining more opportunities to grow. You can see the publication track record. Wrote as much as I could, write consistently. Every abstract needs to go to a paper. Any idea, ask the question, and ask how can I actually answer that question in a cohesive and cogent way. Team science is immensely valuable. And what I made sure I did early on was to bring together every aspect of our institution to help me answer questions about pancreatic cancer. So other basic science, radiologists, gastroenterologists. We started the first early EUS for biopsy of pancreatic cancer and published the first 2 to 3 papers when it was basically, you have a mass, you're jaundiced, you get an operation. And we help define that with endoscopic ultrasound, you can actually make the diagnosis. Not that it's necessary, but it became a tool that eventually will be a part of precision oncology. But that was really about building teams. In the seminal moment that I got credit for building teams, one of my colleagues, I had just gotten another award from the NIH, but one of my colleagues had 5 RO1s. And the institution was choosing between himself, this guy, and me to lead a pancreatic cancer school. And surprisingly, they chose me because he clearly was a successful investigator, but he was an army of one. He could not work with anybody. And here's a guy who has one large grant that they say now you can lead the larger institutional one. There were only 2 in the country at the time, Hopkins, Nebraska, and we were the 3rd at the time, and had probably 3 to 4 cycles of renewal. But he was again leading a large team, and the same thing at the same time building the health disparities. The university gave that opportunity because I was willing to do that. So once both writing consistently, building a busy clinical practice, and secondarily building a parallel research program in a linear fashion, so my research was in line with what I was doing clinically, it was a chance to decide what would I do different. And one of my early recruits as I became the division director was a young woman who we were recruiting her husband to be a head and neck plastic and oncology surgeon, was a trailing spot. And she just had her 2nd child, was still nursing and was coming in, and I arranged my schedule to meet with her. I didn't know her well at all. She just left Oregon, finishing an MIS fellowship, but her name was Mary Hahn. And so Mary came and I got to meet her. I called a few friends in Michigan and they said, you know, you're lucky that you can get it. And everything they said about her was true. She was phenomenal. And so hiring 2 or 3 other outstanding individuals, knowing that if I ever left, Mary would clearly be the person who would follow me, and that's what happened as I went to Minnesota. Mary became the division director. When I came back for SVP and Dean, I wanted Mary to be the next chair, but timing sometimes is everything. Kirby wasn't quite ready to step down, and the dean at Stanford, a guy named Lloyd Minor, who I knew well from Hopkins, called me about Mary at his first visit, and he said, Selwyn, I think she's outstanding. And I said, you're right. And he smartly knew he wasn't recruiting Mary, but was recruiting her husband. And so that's where she ended up at Stanford and has done a phenomenal job. But as I finished at UAB, I had a P60, I had a U54, and I said, what else can I do? So Minnesota was not where I wanted to go. We told our kids on a trip to Disney World that we were going to Minnesota, and they were like, where is Minnesota, Dad? And this was not easy. My oldest daughter was in the 10th grade. I had one in the 8th grade, one in the 2nd or 3rd grade. So this was a big move. It was about, Dad, we go to Minnesota, where can we get our hair done, right? There's just not a lot of black beauty shops in Minnesota. So we had to find that, we had to learn the world, and yet it was a good move for the family. I told Doug that, when I told somebody that for the first 6 months, my oldest daughter, I came home and said, Dad, I ate lunch again by myself. There was 6 months of that where I had to hear that story, and it was heartbreaking. But at the end of the day, I told him that she graduated valedictorian and homecoming. So she overcame that isolation and got admitted to Harvard and chose to go to Duke instead. But they enjoyed the move. I learned a lot as I both began to lead a department. These are basic rules that Carlos and Doug follow, and I follow as Courtney Townsend laid out. Practically as a chair, develop and promote your people. Don't lose money and grow programs. Surgery departments are not necessarily the institutional asset that loses money. It's the engine that drives the institution. And in fact, of all the jobs I've held, the best job is being a surgeon. You typically, as a surgical chair, make more money than you need, still do research, still get a chance to work with trainees, you get close enough to understand what faculty are trying to accomplish. But the other thing that that Courtney said, even as big as you are, remember, even as a surgical career, you have a ball. And he nicely said, remember, it wasn't Caesar's end, right? So these were his principles that I lived by. And when I was recruited to Minnesota, the reason my family came is because the dean recruited my wife and kids. She made sure any and everything they needed, they got. And she said to me, Selwyn, your family needs a promotion, not just me. So my rule was, whenever I moved, my family get a promotion, not just me. I'm going to make sure that if I'm making the move, I'll be worth their time and they need to benefit from it as well. So wherever I've gone, as I bring this to closure, I've always remained grounded in who I am. So doubled the clinical business at Minnesota, became a top 10 NIH funded department. Eric Jensen was my partner there. And I love the practice of care in that area, complicated and competitive as it was with the Mayo Clinic down the street. When I moved back as dean to Alabama, still made sure my core identity was in the Department of Surgery. Bart Rose was my partner. Jennifer Brown was my nurse, and my PA they were phenomenal people who I never lost sight of. And so no matter what my title was, my identity was in the Department of Surgery. And at Memorial, I still see myself as a department. I still go to the OR and still operate because that's the core of who I am. And it's important in the institution because if you lose your grounding as a leader, the further you get away, people often can forget who you are and what you're trying to do. Someone said, when a general gets too far out ahead of his troops, he or she can be confused for the enemy. And that is true. When people can't see you and you make decisions that appear irrelevant, it's easier for them to shoot you than to follow. So that's a principle I've tried to follow. My patients have been grounded. Both of these patients are no longer alive. One with a complex cholangiocarcinoma who got a Whipple and an arterial resection. This woman had a CA19-9 of 51,000 and was unresectable initially, had a remarkable response, got her Whipple done, and about 14 months later called me and said she had back pain and I knew what her problem. She had recurred. These are the departments and the faculty I find that have been compelling as being a part of them and being core to who I was and who I am today. My research journey has been really supported by multiple people. And the guy on the end, John Ruffin, was my high school science advisor. So he helped me do an experiment in botany on plants and hydrophilic growth, so growing plants in water. And so you never know what connections you make and how they may matter. He became the inaugural director of the National Institute of Minority Health Disparities and was my friend and mentor for the entire time of my career. I just gave a talk for him in New Orleans at Dillard. All of these other individuals have had a profound impact. Masato and I developed a CRAD, a conditionally replicative adenovirus that's just going into clinical trial now for unresectable pancreatic cancer. And he's the head of research at Minnesota in the department where I was. Leadership has been critical. And Dave Rothenberger was my deputy chair at Minnesota, and he was the other finalist for the job of being the chair there. So when I took the job at Minnesota as chair, I didn't know this, but every faculty member wrote to me and said, that guy should be our chair. And she chose me instead. And she said to me, do you think you can work with me? Absolutely. But I think he thinks, well, here's what I'm going to do. This is a sign of leadership. He said, I believe you can collaborate and work. But the first thing you're going to have to do when you take over the job is you're going to have to cut it down. The department can't afford to pay two children. And for 18 months, he and his wife were senior chair job. He said, what I'm going to do is I'm going to pay a salary for you for 5 months. You work with him, you'll partner with him. But if you cut his salary, no matter what title you give him, he'll never support it. So she paid his salary. He became a great partner. At the end of 5 years, he gave himself a reduction in salary. I didn't have to do it. But that leadership level allowed us to transform the department because he had great trust in the department. Every faculty member trusted him. And how I treated him was going to determine how they treated me. So leadership does matter. I recruited Herb to UAB, and his wife, when she first came, she said, the only thing I know about Alabama is Selwyn. I don't like it. And eventually I got Herb to come visit with his wife, and within the first visit, she's like, when are you going to offer him a job? It doesn't quite work that way. He's got some more interviews to do. Jeff Drebin is clearly a great colleague, and I'll share more about him. Gil hired me. And John, after 2 years, after he realized my career was not going to just go off in the sunset, became my closest ally. He got over it. Took a little while, but he did. So I would say the most challenging part of my life, even though I really enjoyed my time at Minnesota, I was offered the dean's job there, and I did not necessarily want to stay in Minnesota, largely not because of people or the environment. They just have a pretty dysfunctional world. Their hospital is not owned by the university. They're still litigating and fighting that battle today. So I didn't want to be a part of that. And the dean who I helped support just left. So I didn't stay, but I looked at a job. I hadn't planned to go back to Birmingham, but I went back, and literally for 2 years, I was depressed. My wife said, why did you stop being the chair? I can't explain. Because I honestly, when I said to you, the chair job is one of the best jobs, I think it really is. Fortunately at UAB, I still had a lot of my grants. I was probably the best funded dean in the country. I had a SPOR, I had a P60. But what most importantly, I still got to operate. I did about a Whipple every other week. So I did 2 to 3 Whipples a month. And I still got a chance to be with residents. The most profound thing I've ever heard, the thing that meant the most to me, is when one of the residents graduated and said, my dean taught me how to deal with it. And I said, man, I can still have a chance to have an impact in people's lives. And that was what allowed me to transition in the role of being a dean, which is largely about just dealing with problems. Don't take that badly. I've grown to appreciate you can make a difference. So it's not what people expect. And it is about dealing with problems. Being a CEO, the biggest thing I've had to learn is this issue of illusion of choice. People I meet in the hospital and people I met at UAB after the CEO, it's, oh my gosh, you can run everything. And what I had to remind them, that as I remind myself daily, with this title, this job now requires an understanding there are certain things I can't. It's not about how much I get to do. It's about several things that I cannot do, right? And there are that limitation because of how you're viewed, the narrow scope of what you do, the illusion of choice goes away. Your chair, there are certain behaviors Doug just can't do. He might have when he was an assistant faculty member, but as a chair, can't do those things. There are several things I just can't do because of my role. And so that it's more so the responsibility to serve and understand the impact of what that means versus the leverage of saying I have more power to do more things. So a lot of meetings, God, that gets old. So you have to actually force yourself to find some things that are fun. So when I go to the OR, it's about talking to the nurses, it's about going to see the surgeons. When I go to a lab meeting, it's about talking to our basic scientists and learning what they're doing. Those are the things fun. The meetings sometimes, they get old. And the reality is the dean's jobs didn't last that years. I was fortunate enough to last as a dean for almost 20 years, so I was very fortunate to do that. And the CEO jobs too are equally hard depending on where you are. So the takeaways as a leader, and here's some things that I want to speak to you about sustaining success, is really understanding your style and what are the factors, how you actually interact with people. You don't have to have a title. You can lead wherever you are. And the best way to get your second job is to do your first job. And if you are in the clinical track, be a great clinician. If you're going to be someone who's going to be a research supported track, deliver on the good. Make sure you're diligent. Make sure you are persistent. Make sure you're focused. Make sure you seek out other people. And understand failure is not final. That you will have many failures in the lab, but it's not final. Keep going back. And if you're a surgeon research scientist, you also still want to operate consistently. Maybe not as frequently as others who are full clinical, but you want to be consistently operating because you're in a referral business if you're not in trauma critical care. People need to be confident that they're sending patients to people, no matter what your lab environment is, that's safe and capable. So this is my team at Memorial now. So everything I do now, for the most part, works through a team. Jeff Drebin just joined. He just stepped down as head of surgery, and he's the chief physician executive. Anil Fadili is a plastic surgeon from MD Anderson in the Brigham. But all of these are the partners that allow me to try to lead an organization that has a long history, but yet in a hyper-competitive environment. So having them work, the world is different from me at Memorial. My chief development officer has 275 developers. I have to raise on annual $500 million. So a big part of my job is raising money as what I do. And so there's a lot of things that necessarily that I didn't know, but over time, you realize that in order to be successful, that's what it has to be. I have town halls every quarter for the organization, give them an update. I have efforts that actually lead the recruitment of new places. I'm recruiting an SKI director. My research world is very different than my clinical world. I'm the first CEO of Memorial who's not a basic scientist. So I've had to make sure that the basic scientists understand that I am passionate and care about science. We have 9 hours each investigate. And so the world they have lived in for 100 years is that their CEO has run the lab. I'm not running the lab. And so that's the navigation that I have to continually walk through. So what are some of the things that are critical for sustained success? Number one, as we talked about the early job, take great advice, make sure there are good people along with both packaging programs, make sure there's a reasonably competitive salary. Once you do that job, do that first job well, and over time period, publish frequently, apply for multiple awards, foundation, philanthropy. The NIH is crazy. I was just telling people the NCI not pay line is 4%. And so we were talking about if you can have an 8 or 10% grant, it'd be funded in any other world. And NIES is almost 30%, but cancer is very hard. But be consistent in doing that. But there are some things that are necessary to go through this journey wherever you end up. And one of the early things is this concept of resilience. I love this equation, which is the modulus of resilience, which simply put in literal terms, it's the ability of an object to sustain an impact from an external force and to not have it create a permanent evil. So just think about that in your life. It's the ability to encounter something that doesn't go well. Doesn't mean it doesn't deform you, but it does mean that it's not a permanent deformation. For an organization, it's a situational awareness to understand risk and vulnerabilities, real capacities, and truly be able to deal with it. It's also practical to your own life when it comes to resilience. Arguably, it may be the most significant thing that allows you to drive and move forward. And this by Rosabeth Cantor speaks about what she believes what communities are able to do with and what it means for a strength of character for an individual. This guy, Mihai Csikszentmihalyi, and you can try to pronounce that as well, believes that it is one of the more profound virtues that anyone can have. And so it's crucial, I think, particularly as a surgeon, whether a case goes wrong, experiment doesn't work, a loved one is frustrated because you're late and it didn't work out or something. This resilience is really key. The other thing too is this willingness to actually stick to it and drive forward. Clearly, when we look at kids coming through school, and when we look at successful people who arise in their academic careers, this concept of grit is really significant. Now, when in Alabama, this was confused with grits, but it's just grit. But it's really having resilience in the face of failure and a growth mind. Is that you're always pushing because there's something to learn and a reason to grow. So what are the things that help support this? And you all have a wealth of access to these things. And I think that they are fundamental for making sure you can progress. That first one is a mentor. And most of you, both whether in residency or whether on faculty, have identified somebody who can speak relevantly to your career. And you may have what I would call as a mentoring team. Sometimes it's not easy to connect with just one person. You may need a couple of people who would agree to work to help guide your career. But having that process and having that individual is an important thing. And have them just take a look at the things that matter. Have them take a look at your CV on a regular basis. Have them understand what you're thinking about your progression and how that is going forward. For every problem that you will face, there is a right and a wrong way to deal with it. The worst example of a person in the most recent time, and I hate to share this, but it's a crazy example, is you guys are in the Big Ten now, right? And in my mind, I knew the best school in the Big Ten, but there's another institution that begins with an M in the middle of the place that think they are pretty good as well, Michigan. So the Michigan head coach has a challenge. It has an inappropriate relationship with his assistant. Now, you don't know that in the prior 5 to 7 years, the president and the provost have been disciplined for having those, not the president having the relationship, he has an email. The provost was actually let go because of that. So the regents had a no tolerance policy. And this coach knew them. Had a relationship for 2 years. Somehow the AD gets wind to it, calls the secretary and the coach in, and they both deny. Doesn't believe it. He calls in an investigative law firm. And the coach is told, you can't have her stay in this job. You can either move her somewhere in the athletic department or fire. He chose to fire. She then called the investigative law firm and said, bad email. Says we were more than something. Now that's a bad situation. Not a good situation. But there are a ton of college football coaches who've recovered from that and have done just fine. I can name 5 who've made that mistake. So the only way you make that worse is to go to that person's house, break in the door, and take a knife out of the drawer and kill her and yourself. And that's what he did. Right? So you're now not only a guy who's done something wrong, you're a criminal. So there was a right way to deal with a difficult problem, and there was a wrong way to do that. And all of these things, you'll have those choices of, no matter how difficult it is, there's a right way to move forward, no matter how difficult it is. You don't want to make the wrong mistake. A coach is often someone who is for a situation and for a task, and it clearly needs to be someone who can help push you through a certain set of things. It clearly may be about performance, and it may be also related to, as I mentioned, a certain situation that you're facing. A sponsor clearly is someone who speaks about you when you're not in the room. They're willing to speak up for you. They also need to have a measure of influence. If they're not respected, they can't probably be much of a sponsor. But if they're respected and valued, and they're willing to speak in a way that you can about yourself, that's who you want as a sponsor. And all 3 of these are powerful. Now, this idea of an executive coach, which Carlos serves, is a vital tool you need at the significant level. I've had an executive coach for probably 23 years, and the same person who knows me well, who knows my weaknesses, who knows my strength, knows my style. She coaches my entire team, in large part to make sure I need to know what I need to know to make sure that they have the best chance to execute. But in this case, it's really navigation, leadership challenges. It's personnel and personal management, communication skills, conflict resolution, team development. Managing people is complex, not because people are trying to be bad, but just life is sometimes complicated and you need to make good decisions. It's not always easy to be consciously confident in leadership efforts. But coaching can help you be more confident as you make hard decisions as a leader. So I'll end up on some of my personal thoughts about leadership going forward. So one of my colleagues reminded me of this: leadership is like respect and oxygen. You only notice it when someone takes it away. Let your chair take a job somewhere else. You'll notice. All right. You may not think he's that valuable now, but you let him leave, you'll understand what a big deal it is. Leadership is bifocal. Be very careful of making decisions and gaining conviction on incomplete narrative. Most of us would like things to be simple. Many things between people, at the minimum, have two sides and can be very complicated. We can see people who like things simple, even at a national level, and yet the world is not simple, quite simple. And so is working with people. So if you can see this person, it's two different women, an older lady and a young woman. Likewise, when someone comes in your office and tells you a story, you just heard one story. You have to be patient enough to hear the other side before you draw conclusions. So this idea of understanding how to basically move forward is also understanding yourself. You've heard of 360s, but the DISC and Myers-Briggs or other tools, but you need to know your wire. You need to know how you're wired, and you need to sometimes know how people around you are wired, so that you don't make assumptions about their communications. It's largely maybe just how they are made. This book is one of my favorite books on core competencies. And the reality is, you can focus on these other four areas: being an executor, being a strategist, being a person who actually manages human capital, being a talent manager. But the most important thing is actually personal proficiency. Practically, I've talked about leading at multiple levels. I skipped an area where you have to lead first. And the first place you have to lead is yourself. You have to develop a level of capacity to lead yourself and develop personal trust. If you say you're going to do something and you tell yourself you're going to do it, you need to get to a point that you make sure you know you're going to pull it off. And if you can't trust yourself, nobody else can trust you. You can't lead anybody if you don't take time to invest and master your own personal tradition. And that starts at the lowest level. Internship, R2, in the lab, R4, R5, fellow, junior faculty. You can start there, but to manage yourself is what's really most important. And those tools and skills will be foundational for having anybody wanting following. Critical to leadership is not just what you think or type, just who's willing to follow. And if they don't see anything that's demonstrable, that either conveys your care for them or your skill to guide them, they'll stay seated where they are. The second book that I'll tell you I love is called The Speed of Trust. And when there is no trust, you pay it back. You all know that, right? you got a new intern class coming in. There won't be a lot of trust that first week. You're gonna double check everything they do. And if they're good, and maybe by December, you will begin to trust them. But until you trust them, there is a tax that you're going to pay. And there's a massive tax in July. All of you faculty know this, right? You slow your operations down, or you now schedule cases where you're going to be in the hospital a little more frequently because everybody needs. Chiefs are new, interns new, and you have to now build that trust before you can actually stop paying that tax. So trust begins in this place that I told you about, self-trust, which is just credibility. That when you say you're going to do something, people can count on it. Relational trust is the next level. And if those two things are fundamental to having organizational trust, if you can't be a credible leader and you can't build relationships of trust, the organization will never follow. My 4 years at Memorial have largely around been building trust. They need to know my voice. They need to know that when I make a hard decision, it's for the interest of the organization. They need to know that as much as they can, my intent is for good, even though the decision might be hard. And that's where trust comes, because I'm not going to be trusted every week. But if they don't trust me, I'll help it. And that's what much of my time is spent doing. My communication monthly, my town halls quarterly, are largely for them to get to know me, to understand who I am. The luxury of being a chair is that you can touch the faculty. Doug makes a crazy decision, he can just say he had a bad day. When I make a bad decision, I get a hate mail. I have to somebody escort me home just because people don't know me. And so that trust relationship is really important to work through. This is a good book of really building the processes of trust and through each of these levels that it talks about. So this is the reason why you and I believe that some of the best leaders in American medicine are surgeons. And more are doing the surgical chair job and then doing something in addition. And here's what I would say are the driving factors. Historically, I think this has changed. Historically, Doug and I and Carlos were not trained in a world where emotional intelligence was rewarded or required. But it is a little more today. I think people are expecting you to read the rules, be self-aware, understand the because of my dog. However, if you do have it or willing to learn, it's foundational for an institution to have a surgeon leading and being involved in leading. In that context, the reason what surgeons bring in the leadership setting is everything that you do for the most part is done in a high functioning team. At the core of what you do in the OR, you can't do it by yourself. It's a bad day when you're the only one in the OR working on that patient. So when you round, you do research, your success is because you learn how to lead and manage and build teams. The whole graduated process of being a chief resident was managing a team. And the process in the OR was a high functioning executing team. Now in that process, you also learn a value and a privilege to do something in a consistent way. One of the craziest things I heard, I won't call this surgeon's name, resident said, boy, I can't wait to get out of the OR with Dr. So-and-so because he said every operation, he does it different. That's a dangerous sign. Right? When somebody decides that every operation I do, I got to do the same operation, but I do it in a different way. You all know that that's a bad deal. And I won't call this surgeon's name, but that was the reputation. Finding a different way to do the same operation. Great surgeons value process being done consistently the same way. When you know a good operation is like a 4th grade event. I tell people if there's a lot of excitement in an operating room, that's not a good show. However, you all know that process is not sufficient. It's absolutely necessary. is insufficient. Surgeons hold themselves accountable as people, right? Organizations need consistency, but they, more than that, they need leaders who are going to demand and drive execution. And finally, there are so many times in organizations where leaders will basically grind the organization to a halt so they get all the perfect information in place. They want every piece of data, but they don't feel comfortable in making the difficult decisions. Everything in your career has been about making hard decisions with incomplete information. Incomplete doesn't mean you didn't have enough. It's just that you didn't wait for all the information when you knew the outcomes you waited was going to be needed. So these traits are clearly what you bring to the table in any leadership setting because of your training, because of your excellence in your practice, and because of your interactions in leading teams. And that's what makes surgeons a valuable commodity in academic medical centers. The institution across the street from the NYP led by a surgeon. Another institution in New York City led by a surgeon. More and more of that's the case. Now, I'm not saying you need to go do this job, but you will have the capacities if you choose to. And most great surgical chairs have turned down dean's jobs or CEO jobs. And that's because the institution understands that they probably have the skill to provide a valuable contribution like none other. Now, the other people who used to be good deans and CEOs are pediatricians, because people can be like kids. So as I close, Carlos mentioned that this hurdle is really my story. Carlos is one of the individuals who's helped support me from basically being on this fence post. Courtney Townsend again said, whenever you drive down East Texas and see a turtle on a fence post, you know we didn't get their buying. That's truly the case for me. That's not the case. I didn't get there by myself. My faith, family, and friends are critical to that. And then finally, take time to read this quote. This is the most compelling quote that I've shown about Martin Luther King. And I would tell you that leadership is not necessary in calm peace. Leadership is necessary at times of crisis, chaos, and confusion. Arguably now, particularly in many aspects of academic medicine, that's what we find ourselves asking the question: how are we going to get through this? What's next? Will funding ever become normal? Will our society return to some level of equanimity or behavior? So King says, no code of conduct ever compelled a father or mother to love his children or her children or a husband to show an affection to his wife. The court of law may force him to provide bread for the family, but it cannot make him provide the bread of love. A good father or mother or leader is obedient to the unbelievers. There are things in life that no law tells you to have. You should. And if society forgets the fact that there are principles that you don't need a stop sign to say this is what is wrong, what is right, you have a problem. But when we choose to do those things that are unenforceable, things that people don't see, people with things that people can't measure, but we choose to do what's right, it's where many of our problems are solved. He also said this fact that the biggest challenge to this happening is not the evil of those who do wrong, but it's the silence and complacency of good people who choose to be comfortable with the status. And those are the ones that create suffering. It's the good people who choose to stand by and not speak. So he was right. That's what many of our problems are. You do those things that nobody can make it. Choose. With that, I'll stop. Thank you all very much.
Thank you so much. Thank you so much, Dr. Vickers. Thank you so much for that. We heard that your love language is wine and paper certificates, so we have that coming for you as
Right,
well.
right,
It was a
right.
wonderful talk.
Sure, but it is gifts. That's true.
While we have a moment for questions to emerge, I have one, if you wouldn't mind taking
Yeah.
it. You talked about a lot about leadership. Most of the folks here will be leaders in their operating room, but probably won't be CEOs of organizations. Can you talk a little bit about followership and what you think and some of these, how these lessons apply to being a good follower?
Yeah, I think a couple things. Back to being a good leader. I think you really, as someone said, when you walk into a room and you're the smartest person walking in, you're in the wrong room. You should always surround yourself with people in some fashion or way who are following, who are more talented in certain areas than you are. If you choose to surround yourself with those people, you got to be willing to listen when they pull your coattail, right? You got to be willing to understand when you've gone in the wrong direction and somebody makes it clear that you listen. Nothing is more frightening is when a leader is told that you're driving off a cliff and they say, full charge ahead, right? It's really scary. So good followers are, number one, are willing to ask good questions. They're willing to spend the time to convey that their questions are not simply disagreements, but they're actually validations for them understanding the follow. And I think it's good followers have to have the ability to confront. And that confrontation may not be direct. It may be asking somebody else to drop that coin of what you need to know. So you have to be smart how to do it depending on how the person's wired. You may have some leaders who just can't take, unfortunately, a direct confrontation, or there's just going to be an argument. But there are others who can speak to them about those issues that you know that are very relevant. So one, have to be strategic. Sometimes you can say things directly and you got that relationship, and that's important. I think the other thing that is important to not only conveying areas of advice as a follower and then setting guidelines as a leader, rules without relationships are problematic, right? So one of the reasons you can tell when some kid's acting up who the mom is, who the dad is they're the ones who might correct them because they have a relationship. There's no relationship. People are like, that's not my kid. The reality is take time to build workable relationships so people can have the freedom to say what they need to say. And many times, things that they say can either be corrected or informed because they don't know. They just don't know where it is because they often are not in your head.
Dr. Vickers, your talk to us was inspirational, and I note many very important Vickers rules. And the one that stuck out to me early on in your talk was everyone in the family needs a promotion. But I noticed many others, and I think you need to have a checklist of your Vickers rules that you can share with us, because I found them embedded throughout, and especially a few more at the end. What would you say if you looked backwards at your assistant professor to associate professor level, what you would have liked to have done differently? Any missteps or things that you said, oh, I would have, if I knew what I knew now, I would do this in a better way?
You know, I would have probably, as I just got promoted to associate professor, the division that I was in had a bit imploded. Largely because the senior guy was retiring. I was selected as the new division director. I wish I could have delayed. I was at a height of, I was really doing a number of things that I think were really beneficial for both my research and my practice. So I wish I could have delayed the burden of trying to go hire 2 or 3 new faculty members, trying to foster and develop their careers. So if you have a rich environment and you're at a peak of doing something, don't try to emerge too quickly. Opportunities will be. And if you have protection and support, being a number 2 or number 3 is not a bad thing. So if I could have delayed that, I would have loved to delay it and would have appreciated more time to continually do that. Fortunately, I was able to get through it, but it was painful.
Dave, do you?
Hi, Dr. Vickers. I'm Dr. Abdullahi. I'm so glad to have met you before your talk. One question I was wondering is, you discussed the importance of mentors, sponsors, and coach. And there's many young surgeons in the room here today. How do you feel the best approach is to meet a sponsor and to continue that long-term connection for them to make that positive change for you? What did that look like for you in your experience as a young surgeon?
Yeah. It's about helping. And I think at the sponsor level, it's a combination of things, but fundamentally, as I told this person, he said, and he was really supportive, said, what was crucial as we were running this race, and let's call it the Kentucky Derby, I didn't put you in as 5, right? You came to the table with significant sets of accomplishments that allowed my sponsorship not to actually appear irrelevant, abnormal, and uncontroversial. So, take at the sponsor level, it's where people now are speaking about truth and a set of accomplishments that simply aren't recognized by the people in the room, right? But you gotta have the accomplishment for that person to speak about. Or you gotta have some attributes that actually say that you're the right person. So you don't have to have a sponsor to be an associate or assistant. You have a sponsor as a resident, but what they're sponsoring are things and attributes and traits that they see that are going to have impact, and they're going to allow you to deliver. So at the core, you have to come with some asset that a sponsor can speak about that you might not have. I think in the context of mentoring, again, it's about advice, direction. Somebody will be honest with you and give insights of how to execute in that field, how to also give you insights of what maybe opportunity you're overlooking and not looking at as it stands in that field. And then it's you proactively giving them a sense that you value what they say. Mentorship typically wanes after the 4th time somebody gives you advice and you do none of it. So you got to understand that you can call somebody a mentor, but if you don't listen to them, that's not going to go there. Right? So if you're going to choose somebody you're willing to respect, choose somebody you're willing to listen and go forward.
All right. Hi, Dr. Vickers, Dr. Williams, the acute care surgeon here. I have a question about kind of guidance. You articulated, and one of the things I appreciated so much about you sharing your story is the ability that you were able to present objective history as fact and not bitterness as a Black man surgeon here in the United States. I think there was something prolific about how you were able to describe the fact that they had to call about your credentials. And I think there's a very interesting time that we're in right now where there's a bit of a disconnect between the history that's still being lived as if it has never existed, and a very real feeling among the next generation of surgeons that they have to explain away experiences that we continue to have. And what does that mean to continue to be an activist or advocate for those stories? While living in a post-racial society that doesn't actually exist. What advice would you give, being that you're able to navigate your journey in such a way that is bright and in a way, like your essence is so forgiving despite all of the injustices that you've lived through. What advice do you have for the next generation to kind of carry that?
Five. One of the principles we shared, you're going to clearly run into situations where people are going to have a problem. Nothing you've done, nothing you've said, just because of the way you look and where you come. And he said, that's concerning, and it will be. But he says, the strength of the response is not to have that be your problem. And so when that patient struggled with me saying, you have cancer, when they've been told by someone that looks like them, that they're comfortable with, and in doing so, saying that you have the liver out. A couple of things. Number one, I was willing to acknowledge that they had a problem with me, not because I was the new guy. I was a black guy who was the surgeon. That was problematic. I was also understanding that, unfortunately, I might have had the same problem as well. Largely because that's what society had actually embedded. I shared with someone that Levi had Desmond Tutu. I don't think I shared it. Levi invited Desmond Tutu to speak at our graduation. I shared it with someone. I don't share it broadly. He spoke about his journey from Cape Town, Johannesburg, South African Airways to Nairobi. And in Nairobi, because South African Airways could not fly in U.S. airspace, he took their thing. He said he walked up the stairs, and he said he was basically paralyzed. He looked in the cockpit and saw two black pilots, and he'd never been more scared in his life. He said everything in his body, everything in his history, everything that he'd ever been taught, where the white man should have left by that. There was nothing in his world that said there could be two black guys flying that plane. He said there was just no part of me that could make me feel comfortable. No matter what I knew and what I thought, everything in society told me that was wrong. So hearing and knowing that, I understood why my grandmother, who was a college graduate in the 1940s, didn't believe that black doctors were competent because she'd never seen them. And so part of my response, number one, not to make their problem mine. Doesn't mean I don't recognize it, doesn't mean I don't like it. The second thing is that you all, no matter where you are in your background, you all have your own journey. And across this room, there are variable distance travel to get where you are. Some of you traveled a long way, professionally and personally, to get where you are. And that variable distance is key that helps define you. But at some level, part of that traveling and distance is about you being exceptional. And so in that case where that person struggles with me because of the way I look, because of where I am, my understanding that there is a problem not lost on me. My goal, though, is to understand that at the end of the day, I have to admit the exception. I told some of some of the black faculty at Memorial, I said, Memorial's going through some transformative time, but I get that. I'm not a basic scientist. But I said, I understood, it wasn't lost on me that the board went to Alabama to get black people. They weren't handing me a bowl of chips. So I said, I'm not unaware of that. I knew that what they wanted to get is the best leader they could find. They didn't give him green, brown, or yellow. And he didn't have to be from Boston, he just happened to be from. So those things are, a part of the world we live in. My daily life is actually just by trying to be good at what I do. realize that there are unique and special consequences because of who I am in that job. I either open the door, close the door for others to look like because of what I'm doing. And that's what I try to do on a daily basis. And you all should as well, because you all have had your own turn.
Dr. Vickers, on behalf of the faculty and staff and students and fellows and everybody who's part of our department, thank you for that inspiring and informative
Thank you.
lecture. We really appreciate it.